I would like to ask you a few questions about the area of work that you're pursuing. So
Sure.
can you tell us about your work with heated yoga and depression, your research and any clinical activities related to that?
Sure. So we, in about 2012, started looking at heated yoga for depression. And this is heated yoga that is 105 degrees. So it's very hot. And it's a standardized sequence. So it lends itself well to clinical trials. And so what we did is we partnered with Area Yoga Studios, which was a nice pairing so that we were looking at something in its naturally occurring community delivered environment. And we randomized, well, in the beginning, the first study we did was open label. So we didn't randomize. We just asked people to go to heated yoga and it worked. And then what we did is we used that pilot data to apply to NIH and we got some funding for a K23 randomized control trial. And we just completed that a couple years ago. And so that publication is under review and that study worked as well.
Excellent. And
Yeah.
what benefits do people find from this modality?
Sure. So our primary outcome in both studies, other than looking at acceptability, feasibility markers, was basically just if it reduces depressive symptoms. And we used clinical interviews with like gold standard clinical interviews and looked at depressive symptoms in total. So it's just a total score on a depression interview with a clinician.
Okay. And you have some preliminary data for that or outcomes?
Yeah, so in both studies, the second study is more rigorous in that it was compared to a waitlist control. And basically, there was a statistically significant difference from pre to post when you compare the waitlist control to the active group that did the heated yoga. And they significantly decreased in their depressive symptoms.